Today, I have published my report on procuring and supplying PPE for the COVID-19 pandemic. It focuses on the national efforts to supply health and social care in Wales. My report finds that the Welsh Government and NHS shared services responded well in challenging circumstances to source PPE. Shared services supplied the NHS with the PPE required by guidance without running out of stock nationally, though some items did run low at times. In normal times, the NHS would spend around £8 million a year on PPE. During 2021, the spend across health and social care is set to be more than £300 million. The Welsh Government and shared services put in place good arrangements to manage the risks involved in sourcing PPE in a very difficult market. But shared services did not meet requirements under emergency procurement rules to publish its contract award notices within 30 days. While the overall picture painted by my report is relatively positive given the difficult circumstances, we cannot ignore the views expressed by some of those on the front line about their own experience. There are also lessons for the Welsh Government and shared services to learn about preparing for a future pandemic, as well as addressing some current challenges.